I'm Sister Handy, and this is health education made easy using layman's terms, drawings, and props for a hands-on in-consultation room approach. Today's topic is urinary tract infections in women. If this is the corner of a consultation room, imagine a bowl of urine standing in the corner. After a while, it might start emitting a little fragrance. After 10 or 20 minutes, that odor might become even more. We certainly won't leave a bowl of urine standing in the corner for 12 hours. Now, that fragrance or odor is a sign of bacteria growing. Imagine that bowl of urine in your body for 12 hours. That's basically what you're doing when you're not going to the loo. You're keeping a bowl of urine in your body. So that's why it's very important, even here in the clinic where the loos aren't always that great, that you rather make a plan to go. In the second place, fluid, fluid, fluid. Imagine a water bottle with some dirt in the bottom. To get that out, I'd use water to rinse it out. Maybe it's tough dirt, so I'll put in a lot of water and rinse it out a couple of times. So that's the same with bugs causing infection in your bladder. Wouldn't you then, if this water bottle symbolizes your bladder, try to rinse it out as often as possible? So to do that, you need to drink enough water. Your body does the rinsing itself, but it needs the water. So please, fluid, fluid, fluid. On that note, coffee might not be such a great idea. I would recommend water. In the third place, I used to work with a bladder doctor who always said wiping after going to the loo seems to be the main cause of urinary tract infections in women. To explain that a bit better, if this is your wee hole, this is your baby making hole, and this is your potty hole, poo hole, then around your poo hole there might be quite a few bugs that you can't see. So that is why it's very important to wipe from the front to the back, throw away, take a new paper, wipe from the front to the back. Because otherwise, even if it's not from the hole and you just had a wee, but you wipe to the front, you might be wiping some of that bugs into your wee hole, which will then cause a bladder infection. In the fourth place, I understand that you've been using an antacid. So I think of lemons as acidic, sour. So you've been using an antacid, anti-sour. This usually helps with the symptoms because then it doesn't burn. Acid sometimes feels a bit of burning on your skin if there's an open spot. Some of these antacids even have cranberry flavor, but that is because cranberries are actually acidic. So to use an antacid saying that it is cranberry flavored is a bit of a contradiction, Because the reason cranberries do help is because they're acidic. So the antacid helps with the burning sensation, but it doesn't help with the healing, and it also decreases the work of the antibiotics. So I'm not saying use acid. Don't necessarily take lemons. The research only shows that cranberries actually do work. I've never seen any studies on lemons, but I'm just trying to say don't use an antacid if you have a urinary tract infection. So to summarize, if you found this video helpful, please like and subscribe so that I can make more content. Then just a disclaimer, this video does not use medical terminology nor physiology, and the advice should not be taken instead of medical advice. The idea is merely to supplement patient education in a way your patient might understand. Always refer to the prescribed guidelines, latest evidence-based research, and adapt according to your patient's specific needs. This video accepts that a correct diagnosis was made, that there are no contraindications, and if medication was needed, it has been given with appropriate instructions. Examples of specific needs might also include the vernacular bladder doctor instead of urologist. Examples of contraindications in this video might be a cardiac condition, so added fluid intake should be advised with caution, and added health education to sexually active women, like passing urine after intercourse and evaluating the type of contraception, might be needed.